The FDA just approved a new treatment that can potentially delay the onset of type 1 diabetes. We're talking about juvenile. Joining me now, Dr. Perry Wilson, author of the book, How Medicine Works and When It Doesn't. Good morning, Dr. Perry. Thank you so much for joining us. So this sounds life-changing. Tell me about the treatment and how it works.
Yeah, it's really exciting. This is, as you point out, for type 1 diabetes. That's the diabetes which is an autoimmune disease where your body's own immune system is attacking the insulin-producing cells in the pancreas, not type 2 diabetes, which is associated with overweight and obesity. So these are generally younger people. And up until now, we could watch this disease progressing with the attack of the pancreas going on, and there was nothing you could do to stop it or delay it. This is the first drug that sort of resets that immune process and looks like it delays the onset of type 1 diabetes by about 2 years. Now, that might not seem like much, but remember, that's 2 years of not having to inject yourself with insulin every day. A lot of these are young kids, even teenagers, who need to be checking their blood sugars. It's going to be a big difference for a lot of people.
What are, as with anything, it sounds like such, a breakthrough in this medical field of diabetes, especially for our youth. As far as the risks, what are the potential risks in this?
Well, this is an infusion. It's an antibody infusion that does depress the immune system, and there are some side effects of that, including some risk of infection. There's some fevers and what's called cytokine release syndrome that was reported in some kids. So it's not benign, but it's only for 2 weeks. It's a 2-week infusion period, and that's it. And then you're done. And so, people are going to have to discuss the risk and benefit with their doctor. But as I said, this is the first time that we've been able to stop what has up until now been an inexorable progression to, full-blown type 1 diabetes.
Incredible. Do you know how long until people can actually start getting this?
Well, with FDA approval, they just have to, get it shipped and on pharmacy shelves and in infusion centers. So I imagine it'll be within the next, month or so.
Very soon. Wow, incredible. Now I want to switch topics now, still health, but actor Chris Hemsworth recently learned that he is genetically more likely to develop Alzheimer's disease as he ages.
You're constantly thinking you're going to live forever, especially as a young individual, and then to all of a sudden be told, oh, this may be the thing that might take you out, was like, whoa, kind of floored me.
So medical tests showed that a gene from both his mom and dad means he's 8 to 10 times more likely to develop Alzheimer's than most people would. Dr. Wilson, tell us about these tests and how accurate are they?
Well, it's for a gene called APOE4. We all have 2 copies of the APOE gene, one from our mom, one from our dad, but not all of us have this E4 variant. And even 1 copy increases your risk of Alzheimer's significantly by about 3-fold, and 2 copies, one from each parent, substantially increases the risk of late onset Alzheimer's disease. That being said, it's not generally recommended that people who don't have any symptoms and don't have any known risk factors get screened at a young age, in part because we're not entirely sure what the best method is to avoid that long-term outcome, aside from just trying to stay as healthy as possible.
What is Hemsworth, for instance, or anyone that gets this kind of news, what do they do with that information?
Well, that's part of the problem. This is not, a screening test like a mammogram or something that we would recommend everyone get. There are many other risk factors for Alzheimer's disease besides just the genetic risk factors. And so minimizing those other risk factors like high blood pressure and high cholesterol, maintaining physical and mental activity through, your younger and older years is quite likely to be beneficial, and might be particularly beneficial in people who have this elevated genetic risk. And I obviously, Chris Hemsworth is a very healthy person. He might be, the poster boy for how to handle an elevated genetic risk of Alzheimer's disease.
It just makes you wonder, if you get to the point, are there certain specific patient profiles that should go out and get this test and pursue it, or not? Anyone can.
I mean, so insurance will generally not cover this test. So people are getting this on their own. We often recommend that people in their older years who have early onsets of cognitive impairment, and it's not clear whether it might be Alzheimer's or not, can sometimes get this test because if the gene is there, it suggests, oh yeah, this probably is Alzheimer's. But people need to be aware that if you do go out and get this test on your own, there's lots of commercially available genetic testing out there. Although it can't affect your medical insurance, it can affect your life insurance. So a lot of times we tell people, talk to a genetic counselor first and understand really what you're getting into before you do these tests.
It makes you wonder, do you want to go and dig all of this up? If there's not much you can do you recommend your patients go take these types of tests? I remember when I was pregnant, I was taking all the genetic tests, and the doctor's like, if you keep screening yourself, you're going to find something.
Yeah, I think it's a really individual decision, and some people will want that information, but I agree, it really helps if it is going to affect the decisions you're going to make down the road. And as I said, the best thing you can do is take care of yourself, be healthy, don't smoke, get your blood pressure under control, get exercise, and you know what? That's good whether you have an APOE4 gene or whether you don't.
I hear that. Dr. Perry Wilson, thank you so much. And again, you can check out his book, How Medicine Works and When It Doesn't. We've got it right there for you.